Hello, Professor Romero and my all classmate. This is Veerpal Uppal, and my fourth week assignment is carpal tunnel syndrome. My patient, 65 years, Hispanic male, and his date of birth is January 9, 1959. Insurance Medicaid. He's married, and he came with his wife with the reliable historians. His chief complaint: numbness and sometimes tingling sensation in my right hand and fingers, and patient complaining of tingling and numbness in the right hand, especially in the thumb, index, and middle finger for the past 2 months. According to the patient, he stated feeling sensation like a straight electric shock in his right hand 6 months ago while sleeping at the night, but not during the daytime. However, 2 months ago, the tingling sensation had been happening every night and sometimes during the daytime too. And now, 2 weeks ago, CH reported that tingling sensation and numbness in the right hand worsened and characterized by throbbing pain and burning sensation worsening in the daytime. Too, at the night time, the wife noticed that patient had been waking up more than 2 times, complaining of throbbing pain and swollen fingers, which felt cold on the touch compared to other hand of the rest of the body too. And he been taking Tylenol 1 gram in the morning and 1 gram in the evening, which is temporary pain relief. But his nature of work of riding three-wheeled motorbike making deliveries worsen the tingling sensation and numbness. And he pointed out that vibration from the motorcycle worsening the tingling sensation and numbness as the day progressively, and by the evening he feels weakness in the right hand and fingers that persistent until bedtime. His medical history is diabetes 2 at the age of 54, hypertension, the last flu and COVID 19 vaccine 3 months ago, no surgery, no hospitalization, no non allergy. He's taking blood pressure medication and diabetic medication and Tylenol 1 gram BID for pain and the right. Pain in the right hand. His family history: his parents died in the motor accident, no chronic condition. His paternal grandmother died due to complication of type 2 diabetes and hyperlipidemia, and maternal grandparents had hypertension but died to natural cause. His younger brother, age 53, has asthma and type 2 diabetes. And his social history: he is the firstborn in the family of four, and he was raised alongside his siblings by both parents in safe neighborhood. He lives with his wife and they have 5 children aged between 27 to 39, married, and live in different region across the state. So CH has been working as a delivery person for a grocery store for the past 20 years and plans to retire by the end of the year to help his wife in the small grocery shop and opened as an extension of their home. And he's sexually active with his wife. He does not taking any smoke or drink alcohol or elect drug, and his lifestyle he engaged in physical activities and balanced diet. Ross, he doesn't have any night sweat, not weight loss. Eyes is denies blurred vision. Ear, nose, mouth, throat, no any complications. Cardiovascular wise, he denies any chest pain. Pulmonary wise, he denies any cough, breathing, and wheezing. And GI wise, he denies any nausea and vomiting. Genitoury and wise, he denies any hematuria and incontinence. Musculoskeletal wise, he reports pain in the right hand and finger associated with the weakness, tingling sensation, and numbness. He denied joint stiffness, pain, or muscle weakness in any other place. Neurological wise, he denies dizziness and fainting. Psychiatric wise, he denies any suicidal thoughts, and he reports insomnia due to pain and tingling sensation in the right hand. Endocrine wise, he denies excessive sweating, swollen glands, and other any cold and cold intolerance. Objective wise, Objective vital sign heart rate 73, blood pressure 140, AD temperature 96.4, respiratory 20, saturation 90, 98, height 5.5, and weight is 184 pounds, and BMI 30.62. Labs, radiology or other studies, hemoglobin A1C 4.2, normal is below 5.7, hence blood sugar are well controlled. Carpal compression test, Dank, Durkin's test positive, and Tinal sign and Fallon's test positive, rheumatoid factor test negative, physical exam journal appearance is very well groomed, skin is clean, no rash or no lesions, head is normal, no scar, hair of normal textures, eyes clear, conjunctiva white perla, and ears, external ear canals clear, and throat is no any complication, muscle skeleton full range of motion in all major joint, 5/5 muscle strength in bilateral lower and upper extremities, and cardiovascular normal capillary riffles, respiratory non-labor breathing, and lungs clear bilaterally, gastrointestinal bowel sound present in four quadrants, genitoury no distended bladder, no lymph nodes swollen. So assessment, differential diagnosis, carpal tunnel syndrome, right upper limb, code ICD code 56.01 is the most likely diagnosis in the case of CHS reported by the patient complaining of tingling sensation and numbness in the right hand and finger associated with pain and weakness. Wrist fracture, nerve damaging condition like diabetes, inflammatory condition, rheumatoid arthritis, and medicine like nestrozole, obesity, and workplace factors such as handling vibrating tools. In the case of CH, he has been type 2 diabetes mellitus. He is obese, and the nature of his work for the past 2 decades involving three-wheeled motorbike, significant vibration in the handles. Additionally, a positive carpal compression or tinal signs and fan test confirm the diagnosis of carpal tunnel syndrome. And another differential diagnosis is rheumatoid arthritis, gout unspecified, and diagnosis is carpal tunnel syndrome, right upper limb. Plan diagnostic X-ray affected wrist, rule out the cause of wrist pain like fracture, arthritis, and an ultrasound of the wrist show whether the median nerve is being compressed. Treatment, the first treatment choice is stronger analgesic like Celebrex 100 milligram BID for 7 days. After 7 days, the patient should be evaluated. If symptoms have not been addressed, corticosteroid injection to be effected, arm injection to relieve pain. Education, patient education on need to make lifestyle modification like losing weight and avoiding task or machinery with a lot of vibration is important to help the patient to relieve stress on the affected limb. Follow up, it should be initiated 7 days after starting therapy to assess the patient's response to treatment and determine if steroid injection or surgery is required. Thank you so much.